My aim is to increase your curiosity about these questions, to lessen your intimidation, knowing there are clues within the statement that can help you and that you know more than you think you know. So here's another question that we have here. We have a 44-year-old woman with type 1 diabetes comes to the emergency department due to abdominal pain accompanied by nausea and vomiting. The patient had a history of chronic back pain due to a motor accident 20 years ago. Her situation renders her unable to work and pay for the increasing price of insulin, which has doubled during the last 5 years. The patient doesn't have medical coverage or insurance, therefore she rations her insulin intake, making her unable to follow her prescribed therapeutic regimen for her diabetes. Because of her situation, the client is at high risk of developing diabetic ketoacidosis. Ask her nurse, which of the following symptoms would you anticipate the client to exhibit? Select all that apply. So if you've been listening or watching my videos, I do have a testing strategy that I work on with my clients. Number one, you read through the statement thoroughly. Number two, you paraphrase. Number three, you pick your keywords because you want to know exactly what it is that they're asking you. And there's a lot of information in here, but what it boils down to is a relationship between what? Diabetic ketoacidosis and symptoms, because that's what you're having to select. So I want to make sure that I highlight diabetic ketoacidosis or write it on my board, and also to select all that apply. So I'm giving symptoms here. So what do you need to know? You need to know what is diabetic ketoacidosis. Who can that happen to? More than likely. And is it high blood sugar or low blood sugar? So I do recommend that as you do questions, maximize every question because it's not a race. You don't have to take the full exam. But the more questions you get right, the more you increase your chance of passing, even if your time runs out. So go ahead and pause and select. We're going to go through these symptoms. Would it be fruity odor breath, deep or labored breathing or respirations, blurred vision, increased urination, increased thirst, fatigue, or blood glucose level of 60 milligrams per deciliter, dehydration, respiratory rate of 8 beats per minute, hypernatremia, or metabolic alkalosis. And so you want to look at these answers here, and you want to go ahead and select your answers, if you will, and pause. And you can think about your rationale. Hypo versus hyperglycemia. We're looking at a relationship with diabetic ketoacidosis and the symptoms, right? So I do talk about this or have this in one of my notes, testing strategy that you can find on Etsy, how I go about looking at those relationships and my key things involved in my testing strategy. So fruity odor breath, if you remember that, we're going to go ahead and talk about the answers now. So your answer, if you will, you should be choosing A, B, C, D, E, F, and H. And so if you look at it, we're talking about hyperglycemia, right? Well, diabetic ketoacidosis happens mostly in type 1 diabetes, and their blood sugars are elevated. So the body is going to try to compensate by getting rid of it. A for the fruity breath, B for the Kussmaul breathing, because they're trying to blow off that extra acid because they're in metabolic acidosis. And then blurry vision, they can't see, got sugar clouding up the vision. Increased urination, body's trying to get rid of the excess sugar. Thirst because of the increased urination. Fatigue, they're going to be very tired. The body has excess sugar. Blood glucose level of 60 is hypoglycemia, because remember, when they look at relationships, they're going to throw in the other condition. Dehydration, because they're drinking a lot of water. They're peeing a lot. Respiratory rate of 8 beats per minute is not one of the answers. Hypernatremia, not one of the answers, because they're going to be low sodium because they're peeing a lot. And we already said metabolic acidosis versus alkalosis. So there are your answers. I believe this is a Nurse Labs question. And remember, you can do this. Maximize each question by really looking at the relationships and what they're asking you for and understanding these key terminologies when it says anticipate. What is the nurse going to look for? Exhibit means to show. All right, you guys. So here's another question. Let me put it on that question. And, feel free to check out my notes on Etsy and to reach out if you need additional support with just question support or even some tutoring to help you become that nurse that you are here to be. I'll talk to you guys soon.